Types of leukemia. Acute lymphocytic leukemia, or ALL. This is the most common type of leukemia in young children, although can also occur in adults. This manifests as immature, small lymphocytes that proliferate in the bone marrow and are typically of B-cell origin. Acute myelogenous leukemia, or AML. Also called acute non-lymphoblastic leukemia, or ANLL. This type is very common and occurs in both children and adults, but is more common in adults. It has an abrupt, drastic onset and usually from a serious infection or abnormal bleeding. This type manifests as uncontrolled proliferation of myeloblasts, which can lead to hyperplasia of the bone marrow and the spleen. Chronic lymphocytic leukemia, or CLL. This is the most common chronic adult leukemia, and patients may go years without signs and symptoms. This manifests as production and accumulation of functionally inactive but long-lived Moyer-appearing lymphocytes. Chronic myelogenous leukemia, or CML. This type of leukemia is mainly seen in adult patients. The majority of those patients go years with minimal to no symptoms until the point when the disease begins to spread very rapidly. This manifests as excessive, mature neoplastic granulocytes in the bone marrow. These mature granulocytes move into peripheral blood in massive numbers and eventually infiltrate the liver and the spleen. Other types. Although rare, there are other types of leukemia that have been discovered. Some examples are hairy cell leukemia, myelodysplastic syndromes, and myeloproliferative disorders.